Right, so some interesting pharmacy law stuff. Important to note that I'm a licensed pharmacist in the state of Indiana, so most of this is Indiana law. So first, pharmacists can give patient information to law enforcement officers. We are protected from civil liability if this information is disclosed in good faith. It's important to note that technicians cannot do this unless it's part of a legal proceeding, either some sort of criminal or board prosecution. Next on my list is anabolic steroids. It is illegal in Indiana to prescribe anabolic steroids like testosterone for performance enhancing and like exercise, sport, or game. It's also illegal to prescribe anabolic steroids to increase muscle mass, strength, or weight without a medical necessity. Another interesting thing with pharmacy law is emergency refills. So say your prescription runs out of refills or the prescription expires. In Indiana, a pharmacist can give you up to a 30-day supply of your medication without a prescription on file. There is a limit with said prescription. You can only do this one time every 6 months. Of course, there's like some other stuff, like with the pharmacy having to notify the office that this is done, and it cannot be a controlled substance as well. Another thing that's interesting is offer to counsel. So in Indiana, it is mandatory to offer a patient the ability to counsel or have a pharmacist counsel them on their medications. So some states have mandatory counselings where a pharmacist must counsel patients on new fills or something like that. But in Indiana, it's only mandatory to offer a counsel on new and refilled medications. Another thing is demise of a practitioner. So if your practitioner, like your doctor, dies, we cannot refill the medication unless it's in the best interest of the patient. So if the patient dies, there are no exceptions. We cannot dispense the medication after the patient dies. So quantity limits I found interesting. There's no federal limit on quantities for prescriptions. So legally, your practitioner can prescribe you 6,000 Percocets. That is a legal prescription. Most pharmacists will not fill that though. Another thing that I found interesting is syringe sales. So syringe sales in Indiana do not require a prescription. There is no age limit for the patient who's picking it up. There is no quantity limit for how many syringes you can get. There's also no requirement of like usage. So you do not have to ask what it's being used for. Most pharmacists will ask, and store policy differs from Indiana law. And then one more thing for this video I'm going to mention is expiration dates on prescriptions. So Schedule II controlled substances like Adderall and Percocet do not have a federal expiration limit. In Indiana, it is a year, like non-controlled substances, like say like Lipitor. For controlled substances, Schedule 3 through 5, they have a 6-month expiration date with a limit of 5 refills.